Are there benefits, though, to blocking IL-4? Because I talked about now all the harms. Turns out, you go on, if you have AD and you go on Dupy, your chances of getting cancer, breast cancer, lung cancer, colon cancer, prostate cancer, brain cancer, blood cancer, whatever the hell you want, cut in half. Half, right? And that makes sense because if we're shifting your immune system to Th1, Th17, that's cancer immunotherapy. It's almost like being on a checkpoint inhibitor to like stimulate your immune system to be more anti-cancer. It is nuts. When that data came out, could not believe it, right? But it's only one study. It was a large database study. They looked at people with AD who started Dupy versus people with AD who started a topical, or people with AD who started a non-Dupy systemic, methotrexate, cyclosporine, and that kind of stuff. Whether it was the topicals or the systemics, Dupy cut the rate in half, right? Because if it was just the systemics, you'd be like, well, maybe the methotrexate and the cyclosporine increased your risk. No, with topicals, same thing, cut your risk of cancer in half. Cancer immunotherapy works better, so if you're on a checkpoint inhibitor and you get a dermatitis, if you go on Dupy, it improves your outcome. The other documented Dupy benefits, and Sheila talked a little bit about these, these may or may not be directly related to IL-4 blockade. The molluscum and warts going away, I think, is. So numerous reports, if a kid's got molluscum and AD, you give them Dupy, the molluscum gets inflamed and goes away. Warts often go away as well, and again, that makes sense because blocking IL-4 stimulates your antiviral immunity. Kids grow faster and taller, less likely to get asthma. They do better in school, and they're less likely to be diagnosed with ADD, learning disability, et cetera. And the earlier you start the Dupy, the more likely that happens. So I have now switched from being like, oh, try all the topicals, and then if you can't get better with a topical, then you go to Dupy, to now I'm like, give them one try of a topical. If they're not doing great, get them on Dupy. And if the parents are like, I don't want to put my kid on a drug, like, I don't try and convince them the Dupy is safe. I try and be like, well, if we don't get their AD under control immediately, they're going to get asthma, be short, be dumb, have learning disabilities, and ADD. So if you want a short, dumb kid who can't breathe,
please, no.
Stay on. Then we'll keep trying the topical.
There are other ways.
Wait, I learned that from ChatGPT, so it should be empathetic. Come on. All right. Guidelines, and Sheila, I agree with Sheila completely. Stopping the Dupy to get the vaccine is way riskier than just getting the vaccine on the Dupy, and we have the guidelines now back us up on that.